Hello friends, how are you all? From last few days we are listening about the virus outbreak in China. So today let us know what this is, whether it is a severe or latent virus, and are we safe from HMPV, and what are the different risk factors associated with this virus, and what are the precautions we have to follow to prevent this virus. So let us discuss one by one. What is this HMPV? HMPV is a human metapneumovirus. This is already present worldwide and it is overlooked pathogen. That is, it is not that much severe virus and it is already present globally. And this virus was first identified in 2001 by Dutch researchers, and they isolated from the children who hospitalized with some respiratory symptoms. If we will see taxonomically, this HMPV virus, it belongs to the Paramyxoviridae family. This family also includes the well-known other viruses like measles, mumps and respiratory syncytial virus, that is RSV. And this is a global pathogen, already I told, with infections reported in various countries among different populations. If we will see the distribution of this virus generally used to present throughout the season, but the peaks we will observe during especially in winter months. And symptoms of HMPV, if we will see, these symptoms generally it will resemble other viral diseases like cough, that is dry cough we can observe in the patients, and fever. That fever is not as much severe as what we used to get. It used to be in low fever, and nasal congestion, that is runny nose and sore throat and wheezing and shortness of breath. There will be a problem in the patients who are affected with this HMPV virus, what we also observed in the corona time. And fatigueness, of course, when virus will infect our body, our immunity system will be affected, so we will feel fatigue nature when we are infecting with the viral infections. Coming to the risk factors, these risk factors are common for both the child and adults. If you will see in the child, what are the risk factors are associated, that is, it depends upon the age. If we will take the kids who are below the 2 years, because they are having very less developed immune system is used to be in the developing stage, they are more vulnerable to these viral infections. And second one, that is the pre-existing respiratory conditions, and children who are already having like asthma, wheezing disorders and some chronic lung diseases, they are at very high risk of exposure to these viral infections. And third one is the congenital heart disease. If children is having this congenital heart disease, they are highly susceptible to this HMPV infection. And immunodeficiency syndrome, if kids are not having the proper immune system and they are having weakened immune systems, and they are more prone to this HMPV virus. That is the children which are below 2 years of age and they are having some disorders like respiratory conditions and congenital heart disease, and if they are having immunodeficiency, they are highly vulnerable to these viral infections. And coming to the adults, elderly individuals, especially who are at a 65 age and above the 65, automatically their immune system is also used to be less, and if we are not taking proper care of our system also, then we are getting immune system used to be reduced. So adults who are above 65, they have decreased in immune system and they are more prone to these viral infections. And chronic lung diseases means like obstructive pulmonary disease, that is COPD. Adults who are having COPD, they are highly prone to this viral infection. And immunocompromised states, that is who are not having proper dietary conditions. If we are not taking our diet properly, then our immune system used to be weak. Already what we observed during the corona period, so people concentrated on developing our immune system very strong. So because of boosting immune system only, we can capable of fighting these viral infections. So if we are having less immune system, immune supporting system, then automatically we are very easily prone to these viral infections. That is, individuals who are having diseases like HIV, AIDS, they used to have weak immune responses, so they are highly vulnerable to this HMPV. And cardiovascular diseases, that is heart related problems, if the adults are having heart related problems, they are very highly susceptible to these viral infections. Coming to the precautions, these are general precautions what we have to follow to prevent the HMPV infection. These precautions are similar to the precautionary methods what we followed during the COVID time. So let us see what are those things. That is regular hand hygiene. We have to wash our hand thoroughly when we are in the crowded places. Even whatever hand sanitizer we are having, we should see that at least it should have 60% alcohol content. If we don't have soap and water, then minimum our hand sanitizer should have 60% alcohol. 70% is better. So if we don't have that one, 60% we should see. And respiratory hygiene, that means we have to cover our mouth and nose with a tissue or elbow when coughing or sneezing to prevent the spread of these droplets, because if we don't know, if we have this issue, then it should not spread to the others. So always we should cover our nose with the mask, and we have to dispose the tissues immediately, and we have to wash hands very properly. Then we have to avoid the close contact. If you are suspecting someone who are suffering from any viral diseases, better to keep distance. So maintain a physical distance from the individuals who exhibiting these signs of respiratory illness, and we have to limit the visitation to young children or immunocompromised adults during this respiratory virus outbreak. If anything will happen like that, like outbreaks will happen, better to restrict yourself to visit these people. And cleaning and disinfection, regularly disinfect commonly touched surfaces like what we use to our mobile phones and doorknobs and tabletops, our electronic devices like chargers, everything you have to disinfect them very thoroughly and very frequently to prevent the spread of this HMPV virus. And vaccination, of course there is no vaccination up to now for this HMPV. If any updates are there, then our health organizations will inform to us regarding this vaccination, and government agencies are saying that it is not that much a very severe virus in India, because we are seeing lot of videos which are really leak out from the China, that our their hospitals are rushed with a lot of young children and adults. So it indicating that some severe stress is going in China. So we are also having some fear that if the situation will create, this virus will create, is it create that situation like COVID-19. So be aware about this vaccination. Whenever government will announce, then we have to take it properly. And seeking medical advice, if you are suffering severely, please consult your medical healthcare provider. And early intervention, we can significantly improve the outcomes, because if we are taking precautionary methods, maximum we can prevent the that spread of this HMPV virus. So first of all, we have to understand all these things, then we can avoid the fear what we are getting from this HMPV virus infection, like COVID-19, how it created that very much stress in the people and how people died during that time. So if we are very precautious about these viral infections, and if we are having little bit knowledge about these viral infections, how they will spread, we can prevent a very pathetic spread of this viral infections. We can educate the other people, not only ourselves, because in villages everybody is not educated about this viral infection. So it is our responsibility to educate the all other people for not to fear about these viral infections, and what are the different precautionary methods what they have to follow. So it is our duty. Please educate each and everyone. And thank you for your keen interest in this video, and remember to like and subscribe for more videos. I wish you great health, prosperity and happiness. Thank you one and all.